In this video, we're going to be talking about sciatica flossing or sciatic nerve flossing. What is it? Why do you get told to do it? And the all-important question of, is it something that you should be doing for your back problem? Before we get into it, yes, sciatica is a back problem. The big issue that we have, and we've heard it time and time again, is, well, I've got sciatica. You're talking about back pain. We're talking about back injuries. Sciatica is going to stem from an injury, an issue in the lower back, and hopefully through this video that will be borne out and make you really realize that in a very clear and concise manner. So first and foremost, what actually is sciatic flossing? It is the stretching of the nerve, the sciatic nerve, under the proviso that it's being impinged upon somewhere. It's stuck, it's not moving properly. And what we're going to do is we're going to put a full stretch from the spinal cord up here, the brain stem, if you will, all the way down to the sole of the foot, the entire length of that whole neural chain. And we're then going to start to almost floss, hence the term, like you would with your teeth, all the way through to get that nerve moving and unblocked. And with that freedom, the pain will go away. But as we drill down into this line of inquiry, line of thought, line of reasoning, we're going to find that maybe some things don't quite add up, and some of the challenges of doing sciatica flossing and the impacts that will have on your back are going to start to become more self-evident. So to break this down, when we're actually doing the sciatic flossing, how does it work? How does it actually happen? How do we get that stretch? Well, if you look at the back of the spine, and we're going to talk about the neck first because it's most obvious. You can see the distance through here is X, okay? Now the spinal cord runs on the back here, and that will then come out lower down the bottom here to form and go on to join the sciatic nerve. But as we do the full forward bending, we can see the distance along here starts to increase, and that puts a stretch. It pulls the spinal cord through the spinal canal, and as it does that, it creates a yanking effect the whole way up. So then lower down the spine, obviously we're rounding the thoracic spine, having a similar effect, and then we get down to the lower back, which we also round as well, and you can see it opening out the spaces here, elongating this part, pulling the spinal cord through here. And you have to remember, this is completely normal movement. The spinal cord is perfectly well designed to be able to do this. We wouldn't want it fixated completely. And actually without getting into too much detail, there are connections that the spinal cord will have with the dura, etc., and all those sorts of things. We don't need to get into that in this particular video, but it's designed to move, and it's got various flexible anchor points along the way. So then we get to the bottom part. Now the sciatic nerve, these nerves are going to come out and they're going to join the sciatic nerve in the pelvis, and they're going to come further down, out and through down the leg. Now as they go down the leg, they're on the back of the leg. So as we flex the hip, we move the hip into 90 degrees, that's going to pull further from the other end. And as we get down to the bottom, we straighten the knee out, further pulling that sciatic nerve now at the bottom part, and then we can point the toes towards your nose, and that gets that final bit of stretch. And then once we're in that position of completely rounded over, we can then either nod our head forwards and backwards, or we can pivot our foot to get that extra bit of movement and really floss that sciatic nerve out. But as we've been through this, you're probably thinking, God, that's a great ordeal, is it not? So that's kind of what sciatic flossing is out of the way. Why are you going to be prescribed this? Well, chances are you're going to be prescribed it because the sciatic nerve is going to be supposedly stuck somewhere. And really it's not the sciatic nerve, it's going to be a contributory of the sciatic nerve. It's going to be maybe the L5S1 nerve root, maybe the L45 nerve root. One of these little nerve roots is being supposedly trapped somewhere, and there's going to be an impact of that. And that's not, and when we're saying supposedly, we're not saying that's wrong or saying that in a sarcastic manner. There may well be some compression at these various roots, but that's the hypothesis. It's not so much the sciatic nerve itself, which really starts a little bit further away from the spine. So what will be happening now is somewhere here as it's coming out, and we'll just take this example here for you, it's most likely being, the hypothesis here would be that it's being trapped in this little bit here. So if there's a bit of compression pressing this little yellow bit of nerve into the bone, maybe it's the disc, that's often a frequent suggestion, then if we just pull that a little bit, if we just give it a bit of tug, it's going to free it off. Now that really raises some serious questions, because is this treatment, is this recommendation, is this exercise designed to fix your problem? Because it's not considering at all the cause of the compression, the cause of the need for the sciatic flossing in the first instance. And if we suppose there are only a limited number of structures and injuries and issues that could really cause that sort of compression on the sciatic nerve, primarily they're going to be discal and the inflammatory consequences of a discal injury, or the facets on the back, they've maybe been strained a little bit. And we know from other videos that those two areas are so inextricably linked in their function and the way in which they work in the human body, then you can't really injure and irritate one without the other having some sort of impact. There's very limited things that can cause this. So the circumstances in which you're going to be diagnosed or requested to do this sort of sciatic flossing exercise are going to be some sort of disc-related injury in the lower back. That is what's causing the problem. But if we think back to the fundamental movements that we had to do to get into the position of sciatic flossing, extreme flexion through the lumbar spine, what is that doing to the disc? Is that really the best idea? And the outcome, what is the outcome here? That we get the nerve to move a little bit more? We have to ask ourselves some serious questions here before we start doing these sorts of exercises. Number one, what is the problem? Is it a disc problem? And if it's a disc problem, do we really want to be driving increased pressure through the front of that disc even more than there already has been that's led to the injury in the first instance? Those tissues on the back part of the spine are trying to close up and you're pulling them apart again even further. And there are plenty of other videos that'll go into the details of how these things get injured in the first instance. The second thing we want to consider is, are we at risk of rubbing those nerves on some of these bony spurs that might be associated with that? Maybe let's suppose we have facet hypertrophy. We have some arthritis in and around the back part of the spine, these facet joints, and that's creating some bony spurs. Do we really want a disc that's jamming onto the little bit of nerve here that's going to go on to form and join the sciatic nerve, being rammed up against a bit of spiky facet joint that's hypertrophied, and then we want to grind it along like so? Does that really sound like it's addressing the cause of the problem? I'll let you be the judge of that. And if we're going down the route of stenosis being the primary cause, bony stenosis, as opposed to what I just described, which would be a degree of soft tissue stenosis coming from the disc, then this raises questions. What are we rubbing that nerve on? And is that necessarily the wisest approach going forwards? Now, if you're watching this video so far and you're thinking, God, I've been prescribed this exercise and I'm a little bit confused right now, that's okay, that's normal. Hopefully it's raised questions. And if you're going back to your professional with this exercise, maybe it's in-person support, maybe it's virtual support, ask them, say, look, why are you recommending this exercise? What is it supposed to be doing? Freeing up the sciatic nerve? Well, do you have symptoms all of the time? 24/7, 24 hours a day? Because if you don't, there's a very good chance that that sciatic nerve, or the root as we mentioned earlier, is not being compressed all of the time. With normal movement of the human body, these nerves are going to glide around. That's why they have those loose attachments to the surrounding canal in the spinal cord. That's why it can move and stretch as we move around. We don't want things fixated. And there's a very good chance if your symptoms of sciatica fluctuate to some degree, they get worse or better, but it's maybe not as compressed as you're led to believe. It may not be consistently, permanently compressed. And if it is permanently compressed, it's very likely that the cause of that would be bony change. The disc is completely gone and we've got a complete collapse of the intervertebral segment and space where the nerve exits. And those sorts of things, unfortunately, you will know that for certain. You will have a very clear understanding of that from the numerous MRI scans that you will have had and the various consultations and the discussions about needing to do some sort of work to decompress that area in a surgical manner. You'll know that. And if you don't, it's highly unlikely that that's the sort of scenario that we're talking about, because it is much more rare or much less likely for you to be suffering that. So we've talked a little bit about doom and gloom and what is actually going on there and what the exercise is and maybe why we shouldn't be doing it. But what should we be doing instead? That is the all-important question, and that's what we want to help you guys out with in this video. Ultimately, sciatica, it could be sciatica, it could be leg pain, it could be hip pain, it could be back pain. But if it's coming from the lower back, if we've got an injury in the lower lumbar spine and we've got that L4-5 disc injury, that L5-S1 segmental strain of whatever capacity it is, maybe it's a spondylolisthesis, maybe it's some degree of minor strain in that segment. There's something there, there's an injury there that is creating strain on the body. We want to decrease the excess inflammation in that area. We want to provide stability and protection for the spine in that region, and we then want to get those hips moving a little better so that they can decrease the amount of movement that the lower back is unfortunately having to do on a daily basis whilst we are recovering. From there, we can work on strengthening and starting to improve the competence of those muscles that protect that region of the spine so we can heal. As we mentioned at the start of this video, sciatica is really a back problem. It is an injury in your back that is causing, in your case, the classic sciatic symptoms that go down all the way down the back of the leg. Or it might be causing some variation on that, maybe just hamstring pain, maybe just hip pain, maybe just buttock and hamstring pain, maybe just calf pain and shin pain. Maybe you've just got it in the back of the heel, that referral down to the back of the heel. Maybe that's you. But it is a back problem. We want to treat it as a back problem first and foremost, go through the necessary rehabilitation steps and focusing on maintaining a neutral spine. Keeping this spine in the safest possible position on a daily basis so it can go through a nice recovery and healing process. And as it does that, the causes of the compression on that sciatic nerve are going to start to abate. As it does that, the injury and the inflammation as a result of that injury is going to start to decrease. And as those tissues start to shore up, the frequency of those relapses and episodes is going to also start to decrease. And on top of that, the severity of those episodes is also going to start to decrease. So try not to get caught up in chasing symptoms. Oh, I've got to do, because I've got sciatic symptoms, I've got to do the nerve flossing. Make sure you're working towards the goal of helping the underlying problem, and you're doing exercises that add to the recovery of that problem, and steering well clear of exercises and activities, because it's not just your exercises, it's your daily activities as well, that will go against the principles of helping this lower back recover as effectively as possible. Now, I know we covered a lot of things in that video, and we covered a lot of topics that we didn't necessarily go into so much detail on, that maybe add value or add to understanding of what we're talking about in this particular video. But hopefully it's made you think twice about doing an exercise like the sciatic flossing. Maybe think about whether it's the right exercise for you and your specific condition. Maybe it's also caused you to reevaluate what is the cause of your back pain and what we should be doing going forwards. And we very briefly at the end covered the steps that we want to be taking to rehabilitate our back, and you've got all the support that you need through our channel, etc., to really help you better understand and then resolve your back pain, whether or not you have sciatic symptoms alongside that, in a way that's not going to run the risks of doing exercises that make you worse. Hopefully you found this video helpful. If you did, give it a thumbs up. Comment below if you've got any questions. You're not quite sure still about something in this video, let us know in the comments below. And as always, if you know someone else that's struggling with sciatica, you've seen them doing the exercise when you've been around with them on the weekend, maybe it's a parent, maybe it's a family member, maybe it's a friend, then share this video with them so they can better understand and evaluate, and maybe then take it and ask questions of the people that have recommended those exercises. Why am I doing that? Is it really doing this? Could I maybe be doing something better that's going to get better results? That's why these videos are there. They're there to help you, and we'll see you in another video. If you want to learn more about the premium Back in Shape membership, there's going to be a video somewhere underneath here. And if you want to stay up to date or tune in to some of our more recent live streams and the Q&As at the end of those, then that's going to be down here. And remember, you can subscribe to the channel up here and hit the notification bell to make sure you know when we next go live, so you can join us for our next live stream and Q&A.